The coronavirus is the latest virus that we're all worried about. But when is your worrying actually excessive, leading you to have a disorder? Hi, I'm Dr. Greg Cason, and this is Off the Couch. There's a new virus in town, and it's the coronavirus. But actually, the coronavirus is something that's been around for a long time. Actually, the common cold is a coronavirus. But the latest coronavirus that we're all talking about is something called COVID-19 that came out of Wuhan, China, and seems to be fairly deadly. At the time of the filming of this video, it killed about 2% of people who were infected. So it's something we all need to be worried about. But when is your worry excessive? When is it too much? So sometimes we're a little sloppy in talking about the word anxiety or worry, and we use those in casual conversations. I use them myself in casual conversations. But let's, for the sake of this video from now on, we're going to separate concern from anxiety. And concern is going to be a healthy look at things. It's when we have something we want to have some emotional energy around and some belief and focus on that we want to be concerned about, like, say, a test coming up, or in the case of this, that we might contract an illness. But anxiety might be something bigger. So anxiety might provide more physical symptoms inside of us, and when we have a health anxiety, it's based on an irrational worry that's obsessive, that just keeps going around and around, that we're going to contract some kind of physical illness. Now, the health anxiety could also be marked by even imagination that you have the physical symptoms of the illness and that you're even misreading the physical cues inside of your body, thinking those are the actual physical illness. Now, having health anxiety about getting coronavirus would be an obsessive worry about getting the illness, or fearing that you are going to be exposed to the illness imminently, like by going to a grocery store, by going to the gym, that you're going to come down with it. You may even view yourself as especially vulnerable to getting coronavirus. But one thing is that people with health anxiety have a very difficult time being reassured that they don't have the illness that they think they have. Even people with health anxiety might go to a doctor and get medical tests, find out those medical tests are negative, and the doctor even tells them they're okay, and then they get reassured in that moment and might feel okay walking out the door, and then an hour later, maybe the next day, they start to fear they have the illness again, or they're going to be exposed to the illness very quickly. So just getting medical tests isn't usually enough for someone with medical anxiety or health anxiety disorder. So having a coronavirus anxiety or health anxiety disorder isn't limited to just coronavirus. It generally can go to any virus, but typically it settles on something at one time. And right now, that's the illness in the news. So that's the illness a lot of people with health anxiety will start to be focused on. Now, we know about this obsessive health condition because it tends to interfere with someone's quality of life. It'll interfere with their daily functioning. It'll interfere with their relationships. Maybe they talk about it too much with their partner, or start to really avoid people or not want to be around other people, even significant others in their life, because they're worried about having or contracting coronavirus. Or it might even interfere with their school or work. Now, how does someone actually develop health anxiety disorder, not just corona anxiety disorder, but health anxiety disorder? We don't really know, but it does seem that people who are predisposed to have anxiety disorders could settle on a health anxiety disorder, and the fact that it is normal for us to be concerned about contracting physical illnesses, especially when we see someone around us who's physically sick. We ourselves may become more concerned about contracting that physical illness and take more precautions, like staying a distance from that person or washing our hands more frequently. Those are actually very good things to do. But people with health anxiety disorder have that excessive fear that goes over and over again. So that may be caused from several things. One, it could be caused by them having a lot of stress in their lives, and so that exacerbates the symptoms that they already have, and their anxiety is already going on. It could be because friends and family around them always worry about their health and will tell them, oh my God, I'm so worried about you. How do you look? You don't look good. Have you lost weight? You don't look good. Or they may themselves show that they're always concerned about physical illnesses and talking about that. Both of those things might lead people to be very concerned about having a health condition that might be something they don't actually have. Another thing that actually happens is something called confirmation bias. And confirmation bias is when we have a belief about something. So here we might have a belief that we're very susceptible to contracting coronavirus, or we might think it's in our midst. And then we start to look for evidence that it's actually there. We look around to see if people are coughing, or we look around to see people wearing face masks and that maybe that's existing around us. And then we watch news reports to think it's going to actually be affecting us. Another thing is just actually a lot of people with health anxiety have had very serious health conditions, and that may have been in their past, especially when they're children. And people who have very serious illnesses in children often become reactive to physical sensations in the body when they're adults because they worry that they're going to start developing physical symptoms again. And it may be irrational, but it's linked to the experience they had in the past. Now, how is coronavirus anxiety or health anxiety diagnosed? Well, I don't want you to do that for yourself here. I actually want you to go talk to a mental health professional or even your physical doctor to help him or her decide whether that is something that you're actually dealing with. But there are some symptoms that we might go over that might lead you to go talk to your doctor about if you have this disorder. So let's talk about that. If you have a preoccupation with coming down with an illness, or that you actually have the illness, if you're not having physical symptoms or just have very vague symptoms that you might be attributing to coronavirus or another health condition, or you have excessive preoccupation about having coronavirus or another health condition, and also you start having unreasonable health-related behaviors, maybe getting yourself screened over and over for the condition, maybe there are home testing kits. Sometimes people with health anxiety use too much. Maybe checking for what the diseases are online, and doing excessive checking online is something I like to call cyberchondria, when you just keep looking over and over online, and then it goes back to confirmation bias. You're continually looking for evidence that you have the illness that you're afraid you have. It's also interesting that people with health anxiety disorders often avoid doctor's appointments because they're afraid to get bad news. So one thing we can do is just go to a doctor's appointment, have them tell us that we're okay, and then start to work on our obsession with having the illness. But if you avoid the doctor and never get any kind of information, then you never will have any place to go but to continually worry. And worry has a particular function in our head. It keeps those negative emotions away, or at least it's an attempt on our brain's part to push down those negative emotions and to keep them at bay. So if you're going to not get information, even that might be bad information, you might just continually worry, and then it never goes anywhere. Also, if you are concerned about having coronavirus or any other health issue and it lasts for beyond 6 months, you definitely need to go talk to a physician to see if this is a health anxiety disorder, or maybe you actually have something else. A lot of people with health anxiety disorder have trouble accepting that they have health anxiety disorder. They're dead set on the fact that they have some kind of physical illness. But if you can at least entertain the idea that you do have health anxiety disorder and you are diagnosed with health anxiety disorder, there is hope and there is help. Actually, there's a type of psychotherapy that works especially well with health anxiety disorder, and that's called cognitive behavioral therapy. Cognitive behavioral therapy is actually the type of therapy that I practice, and I really see its value here. You actually work on someone's beliefs about having the anxiety. You work on their the negative beliefs they have about themselves, their misattribution of physical symptoms, that actually thinking certain physical symptoms inside their body are due to this health condition, and you even help to expose them to conditions that they might be avoiding in order to help them reduce their anxiety overall. Cognitive behavioral therapy not only works on someone's beliefs, it works on their identification of the physical symptoms, it works on their identification of the emotions, it works on their behaviors, and works on their interaction with the environment. And if all of that doesn't do well, there's also something called SSRIs, or selective serotonin reuptake inhibitors. And those types of medications are helpful with obsessive thought that's typical in people with health anxiety disorders. Now, the key with health anxiety disorder is to help reduce that anxiety down to concern. We never can take that concern completely away, because that's something inborn to all of us. We're all going to be concerned about having health conditions. So we're really just turning down the volume on the worry to go to a healthy level, and that's really the key. But as time goes on, as we get older, sometimes our concerns about having medical conditions and health conditions increase. So people with health anxiety disorder over time might have to re-engage and really help themselves through certain points when things get worse for them. But there is hope if they keep practicing their new beliefs, keep practicing their new behaviors. They can actually have a good time in the future. And as for coronavirus, hopefully that will come and go like other big viruses have in the past, such as SARS that we all went through not too long ago. But there will always be one in the future. So it's good to be healthily concerned or have a healthful concern about things, but don't get overly concerned that it starts to limit your life. I'm Dr. Greg Cason, and this is Off the Couch.